What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Tuesday edition of the Virus Update for Tuesday, August 19th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. You need to be informed on them. COVID is still going around. We're in the middle of a COVID surge right now here in the United States. Levels are elevated for COVID right when kids are going back to school, which means back to school illness is a thing. And I've already heard stories about kids going to school, testing positive, and then bringing it home to other people. So you need to be informed with what's going on. Subscribe if you want to be informed down below. If you like today's video, give it a thumbs up. Let's try for 150 like button hits. Share this video with anyone you know, and leave your comments down below. Alright, today's video will take about 15 to 16 minutes of your time, somewhere around there. So give me those 15 minutes, and I will inform you of what's going on. Starting off with this, COVID reinfection may raise risk of persistent symptoms by 35%. This is not the first time we've seen a study that said, getting COVID again and again is not good. It increases your chance of long COVID. Yeah, U.S. adults reinfected with SARS-CoV-2 may be at a 35% greater risk for long COVID than those with one-time infections. A team led by the Independent Research Institute, RTI International, posted last week on the preprint server of medRxiv. Take a look at this. Those vaccinated between first infection and index faced lower risk of long COVID from reinfection than those only vaccinated prior to their first infection, suggesting that more recent vaccinations may lower the risk of long COVID following reinfections. Now, I'm not sitting here saying, oh, you got to go get vaccinated, because oftentimes I get these comments saying, we're not buying it, we're not taking your vaccine. No, I'm not here telling you to get vaccinated. I'm telling you, you should do whatever feels right for you. Do whatever you feel is in your best interest. All right, moving on. Jammer posted this. Research published in the European Heart Journal studying 2,390 people from 16 countries found that SARS-2 infections, even mild, likely causes blood vessels to stiffen and age by approximately 5 years, increasing the risk of developing cardiovascular diseases, strokes, and heart attacks. Just confirming something we know even more. Blood vessels can age, especially in women. Yes, they can by 5 years. So you really want to be careful with these viruses. They could be really bad news to you. All right, moving on. Back to school season brings the rising colds, COVID, and viral infections. This is kind of a silly, so I think some of this is a silly article. It starts off, we share the summer stories, and we share the viruses we may have at the time, and then it goes on to this. Someone said, the favorite part of the day is recess, but recess and other group activities create opportunities for illness to spread. Yeah, the cough, the congestion, maybe the irritated, watery eyes, throwing up, diarrhea, things like that. We don't have to do this if we take proper precautions, clean the air, and yeah, I hate to say it because so many people don't like hearing about it. Pretty sure I got one here somewhere. No, I don't have a mask on hand at the moment, but oh, here's one right here. Here's a mask. Yeah, I mean, masking and clean air does work. Now, when they're referring to recess, obviously at that point you're outside, but nonetheless, going back to school does mean increased risk for illnesses. I'm pretty sure we're going to see some school illness reports over the next week, and if not, there'll be things going around on social media. We'll see comments as, yeah, my kids went back to school and they got sick this week. I'm sure we're going to see that type stuff popping up, even if it's not an actual article, though. I would be surprised if we don't see an article or two pop up. All right, let's run some numbers, shall we? Dennis, the COVID info guy. Queensland Weekly Respiratory Surveillance Report from August 12th to August 18th, 2025. Reported cases of COVID, 961, or down by 17.5%. Good news, and that continues. Influenza, 4,229 cases, down by 13.5%. RSV, 912 cases, down by 4.3%. And we do have some more numbers. Australian Respiratory Surveillance Report, Dennis the COVID info guy once again. from July 28th through August 10th. In the last fortnight, COVID cases were down by 16.1%. Influenza cases, they actually went upward, up by 2.3%, and RSV cases were down by 8.5%. Total COVID cases reported were 8,629. Influenza, yikes, that's a lot of cases. 39,490 influenza cases reported across all the regions of Australia. RSV, 11,708. COVID-19 has been the leading cause of acute respiratory infection mortality across 2023 through 2025, and he puts COVID is not over. It really is not. COVID still is going on, and it continues to be a problem. Already, Jannik Sinner has withdrawn from the U.S. Open. Yes, and I do believe, I haven't been following, this is world number 1, right? Someone let me know down below. And I think it's the star-studded U.S. Open mixed doubles will be without men's world number 1, Jannik Sinner. This is not the first time Jannik Sinner has been sick. When I saw this, I was messaged about it. I've seen this a lot of times, this particular issue of what's going on right now. I had to run a search on my website. You know, it's real easy to do that. You can just type in a name. And in this case, like Jannik Sinner, I already have it listed here. You just type in a name and look what happens. Not once, not twice, not 3 times, not 4 times. Now, I did add the current one, so that makes it one of the times listed for being sick. And then, looks like Virus Update News Stories, October 29th, 2024, pops up. And then in January, there's also 2 potential, actually, no, there is 1 potential time frame back on January 20th of 2025. That's this year. And then we go back to 2024 Olympics sits out due to illness. I don't know. Does this sound like long COVID to you? It sure does to me. Constantly being sick. I mean, we could go back to the first thing we talked about today. Take a look at this. Reinfection may raise risk of persistent symptoms. This person seems to be having persistent symptoms because they constantly keep getting out of tennis world for illness. All right, moving on to this. Measles in Montana. I believe there were 2 new measles cases reported. Nonetheless, here's the total count for Montana. Yeah, I actually found a Montana measles dashboard. I just found it today. Montana has a total of 31 measles cases reported. 2 of them resulted in hospitalizations in Montana, so that's interesting to report. Taking a look at what's going on in Canada, let's refresh this. The viral activity level for COVID is moderate, flu A is low, flu B is low, and RSV at this time is listed in the low category. Let's take a look at what's going on with the air qualities across the United States, shall we? We do need to refresh this. While we're waiting for this to refresh, let's pause and take a hydration break, shall we? The southeast U.S. is currently some yellow and some moderate air qualities. The northeast is not doing bad at all. I'm happy to report that. Canada is not doing bad at all. You do see some spotty issues in the west coast, but again, the majority of the country is much better than it was a few weeks ago. I am noticing this. Northeast Mexico. Some bad air qualities popping up. I don't know. Are there some wildfires going on there? If there are, I'll look into it, and someone let me know if they know anything down below. That's rather interesting to see that. Taking a look at what's going on in Pinellas County, Florida, and we do see sick person listed 3 times, and a few other things listed there. Taking a look at Philadelphia. We see here in my city of Philadelphia, 758 EMS incidents have been reported on Monday, and I can tell you what, I've heard a ton of ambulances today. Not too far behind me, there's railroad track, and you go back a little bit further, and within a mile of my house, there is a hospital. I can actually see from this window, top of the hospital on a certain days, and I've heard a lot of ambulances going there today. That's not a good thing. Take a look at the respiratory emergency calls in Montgomery County, Pennsylvania. 1, 2, 3. We have good air quality. I said this yesterday. I'm concerned about that. During COVID surges, I have seen respiratory emergency calls go upward. Cardiac arrest is showing up in Upper Marion Township. Stroke is showing up in White Marsh Township. That's not good. Let's take a look at what is going on over in Chester County. Hey, not bad right now. We'll take that. Bucks County, Pennsylvania. We do need to refresh this. That is not up to date. This does not update on its own. Okay, but it is still 8 calls and we do see a psychiatric emergency. We see a bunch of things going on there right now. Hospital situation in Pennsylvania. You see there are some hospitals in yellow in eastern Pennsylvania, but I don't know if we've seen this on the virus update before. There's a hospital that actually updated in western Pennsylvania. This is Forbes Hospital, AHN. I believe AHN stands for Allegheny Health Network. Someone correct me there. Forbes Hospital Emergency Department is, yeah, take a look at this, is overcrowded. Looks like a total divert until 2300 hours. Yikes, that's not good. 3 hospitals with problems in southeast Pennsylvania, a few hospitals in the Lehigh Valley. St. Luke's Monroe, once again, emergency department is at capacity. My goodness, it just does not end for that hospital. I mean, back during the winter months was bad there. All right, we did not have a update to wastewater again this week in Pennsylvania. But let's take a look at what's going on with the other dashboard. Again, this is up to August, it says August 9th, but let's take a look at what it says down here. Yeah, this is up to August 9th. Pennsylvania has 260 people hospitalized for COVID and 23 people in the hospital, kids in the hospital at this time. New Jersey, not much in the way of issues today, although this just popped up. This is new. I did not see this earlier. Jersey Shore University Medical Center. Patient volume. Inspira Center Mannington has a specialty issue. And, University Hospital now has a psychiatric divert. So, yeah, a few issues going on in New Jersey. New York State today reports 335 new cases. And take a look at this. Let's start off, since I already have this here. The central region of New York. Yeah, take a look at that. Pretty big increase today for hospitalizations. They have 24 hospitalized. The report before that was 13. So the central region of New York did have a big increase, which is why, well, one of the reasons why New York State as a whole did go up today for hospitalizations. Hey, it was 324 last week. It's up to 375 today, but that is higher than any point during this current COVID surge in the state of New York, and the number of people in the ICU at this time is at 36. Virginia, emergency department visits for COVID are trending upward, and they are 1.4% of all emergency department visits at this time. Take a look at this. Yes, now we are taking a look at emergency department visits on the national level, and you can see here, they are continuing to go upward. They probably will for a few more weeks, and then peak at some point in early September. We're coming to the backside of the summer wave, and let's take a look at the age groups, shall we? Oh my. Oh my. What age is this? Yeah, okay, that's really bad. We now see that 2.59% of all emergency department visits for COVID are now for kids. And mind you, again, school is in session, and take a look at that. COVID is sending kids right to the emergency department. You know what? That might even make a portion of today's video title. Wow, that is really bad. Just in time for back to school, kids are going to the emergency department for COVID. Something like that. Yikes, yeah, that's concerning. And someone's going to say, oh, well, it's just a runny nose. Parents are sending kids to school. Okay, come on. Again, it's not good. Let's not try and minimize things, shall we? Nationwide for COVID is listed high in wastewater at this time. This is from Wastewater Scan. Yeah, we got Wastewater Scan working today. Some parts of the website are still not working as of a couple hours ago. Take a look. Can we? No, we can't see the colors on here. Like I said, some parts of the website are still not working. I'm afraid to hit that refresh button. Are we going to lose Wastewater Scan if I do that? Let's see what's going on at a few of these wastewater sites, shall we? Youngstown, Ohio. Yikes, that is trending in the wrong direction for COVID. It is already high and continues to go up. Let's see what's going on at Union Beach, New Jersey. Yeah, that's going up a little bit. Has slowed off slightly. Let's go down to the south. Let's actually click on somewhere in Florida today. Jupiter, Florida. What's going on there? Yeah, you can see that. Looked like it had peaked. It dropped, and then it's going back up once again in Jupiter, Florida. How about Miami? Let's go to the one of the Miami wastewater sites. This is Miami area. Miami has trended down quite a bit. Let's take a look at North Miami, I believe this is. And that wastewater site also, it's not dropping as much. Let's go out to the West Coast. Let's see what's going on in San Francisco, shall we? And in San Francisco, we see, yikes, after a drop, wastewater for COVID is going back upward. Once again, that is not good. And taking a look at the other San Francisco wastewater site, that one is leveled off a little bit. So still a problem there. Now let's end today with what's going on in Boise, Idaho. And we do see here Boise, Idaho also had a COVID surge this summer. Still are, just a little wonky movement at the end. I think maybe they will start to peak soon. Hopefully they will. Taking a look at what's going on. What is this? Lander Street, Boise, Idaho. And we can see that went up. It has dropped a little bit, but nonetheless, it is still listed at high. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up. Subscribe down below, hit that notification bell, share this video with anyone you know. Of course, leave your comments down below. Ways to support the channel, such as Patreon or becoming a member of the channel, are listed down below. I will see everyone again next time. Until I see you again next time, which is tomorrow, stay safe, everyone, and have a fantastic Tuesday afternoon. Thanks for watching.